Welcome to another Two and a Blue interview. Filming, as always, from the Energy Defenders studio. For any of your solar and roofing needs, call Energy Defenders. We are here with Doctor of Naturopathic Medicine, Kyle Myers.
Thanks for having me.
Finally got you, man.
Yeah, I'm excited to be here.
Happy to sit down with you, man.
We've known each other for a long time.
Yeah. Hey,
and baseball brought us together.
Yeah. It's been a while.
I think you were the only one that went to my dad's house in Atlantic City on Morris Ave, and we would have a baseball catch right in the road.
Yep, I remember
right outside of his apartment.
I remember that. Yeah.
And we would walk right down the street to the Trop. There was a Dunkin' Donuts there. We'd get some donuts in the morning.
Wild, man. Yeah, that's fun.
Yeah.
Goes
back a while.
So, you're a naturopathic doctor.
Yes,
which
sir.
Is that otherwise known as a holistic doctor?
Yeah, it's one type of holistic doctor. It's a type of training. It's a specialized type of training that you can only get in a variety of schools in this country. There's 2 schools in Canada as well that recognize my degree that makes us eligible to have a license to practice medicine as a physician. In the state of New Jersey, we are not licensed and regulated as physicians, so I'm merely serving as a wellness consultant, and I work with my business partner who's a medical doctor to collaborate on all of our cases in terms of ordering labs, ordering different pharmaceuticals if necessary, etc. But we do try to basically give people options. You know, I would describe it more in the camp of complementary and alternative medicine, or CAM is what it's listed as in the research, where people will come in and they have a chief concern, whether it be headaches or high blood pressure or high cholesterol or fatigue. Fatigue's probably the number one thing that people will present with as a symptom. And we run traditional testing through LabCorp or Quest. We also have other non-traditional testing, I phrase it, that we can dig into, and we might get into that a little bit. But we use the lab testing through LabCorp or Quest. We have LabCorp in our office, and we draw LabCorp for our patients to do extensive testing on what somebody's individual needs are. From a nutrient standpoint, a hormone standpoint, I would say I specialize mainly in hormones, gut health, and oncology. So those are the areas that I've had the most clinical education in, or continuing education in. And so I find that that also relates to a lot of other symptom patterns people may develop, you know. So it's just a way of looking. If you look at naturopathic medicine, the breakdown of that is naturopathic means using nature to address pathology, to address some type of medical imbalance, right? When you look at a traditionally trained provider, you're looking at allopathic medicine, which is against pathology. So if you have an infection, you use an antibiotic. You don't use nature to allow your body to heal itself. One nice clinical pearl that you can use if you have an infection to allow your body's immune system to be supported is something called cold wet socks. So cold wet socks, we call them warming socks, but it's just cold wet socks. So you wear cold, wet cotton socks, and then you put dry wool socks on, and you go to bed with them, and in the morning they're dry. And what that's been found to do, it's a form of hydrotherapy, or using water as your therapy, and it's been shown to improve your immune system. So that's allowing your body to help heal itself. And of course, since I'm in this field, I recommend it for all of my patients, but then when my kids are sick, I forget about it. So naturally, unless I'm sick, then I remember, you know. So it's something that's very simple, but allows you to use your own body's immune system to try and help work through infections. Now, if an infection's severe, of course, you should use an antibiotic, absolutely. But we're also dealing with a silent epidemic of overuse of antibiotics. So it's just another way to approach the care of somebody who has a chief concern and give them evidence-based or natural alternatives to their health issues. So it's been something that I've had a passion for because of some things I've gone through in my life and some things that I've seen family members go through. For me, it was a back injury at 16. I was given an option of surgery or opiates, and I chose the opiates to help with my pain relief because I was 16. I didn't want spinal fusion. And then down the road, when I was in my mid-20s, towards the end of towards the end of undergrad or early 20s, I decided I wanted to try and learn about other options or other alternatives that people can use that have some evidence behind them to help support their ailments. Because I couldn't believe at 16 I was only given a surgery or a prescription as an option, and I wanted to try and avoid that approach for people when I became a doctor. So it was a way of learning other tools. You know, our training as naturopathic doctors, and there's two different types of naturopathic doctors we can get into, it's very different from what a traditionally trained practitioner gets, whether it's an NP, nurse practitioner, a PA, physician assistant, MD or DO, osteopathic or medical doctor, because we have to learn all of that traditional medical stuff, but then we also have to learn our natural stuff as well. So we had about 14 to 16 courses a semester because we had to learn the traditional and the natural. So it was very intensive. It was a 4-year program. Other NDs in this state, most of them, in fact, just get an ND degree like I have online for like a few $1,000s, where mine was well over $300,000. So there's a big difference in the type of naturopathic doctor you could go see, and that's why you want to find a license eligible like naturopathic doctor like myself, who has received a degree from one of our naturopathic medical schools in the country or in Canada.
Roger that. So what would you do for the 16-year-old who came in with the same issues you had when you were 16?
So first, I would look at what's going on in their dietary habits and emotionally. I believe that a lot of pain is associated with emotional undertones of things that are unresolved traumas, and I feel like that's still why I have some chronic pain left over, is because I haven't fully dealt with or gone through the process of going through some of that trauma that I'd experienced. But first, it would be evaluating what trauma they have. You know, at the time, my brother was in and out of prison. You know, my other brother was off, haven't had a family, and was off on his own. So at that point in my life, those were big traumas for me. And for some people, it might not be a trauma, but for me, it was. The other things were my diet was terrible. At the time, I drank a lot of Mountain Dew, you know, food coloring, sugar, all of those different toxins in that way. I had some fast food at times, you know, go to Wendy's from time to time with my dad and just pick something up fast because we had a lot of sports. So I think looking at what their traumas and what their dietary habits are play a big role, and then run some labs, get some testing done, get some diagnostics to see what is off that we can objectively track and follow, and see if as those blood markers improve, do clinical symptoms of pain improve or change at all. But basically, as a Band-Aid, I would have offered, you know, curcumin or boswellia or some other type of natural anti-inflammatory supplement instead of going the route of a surgery or an opiate. But at the same time, you don't want to get stuck just having a provider in this more alternative space just recommending a natural alternative without looking at the underlying cause or evaluating what could be underlying some of those issues, because that's still an allopathic mindset, an against pathology mindset. I see a lot of providers that will come into the natural medicine field who may be retired ER docs or something, and they're trying to get out of the hospital system. And they'll make that same mistake of looking for a natural alternative to a symptom pattern and not evaluate where that's stemming from. So we're really trying to get to where things are stemming from or where the root cause is, instead of just putting a supplement or pharmaceutical Band-Aid on things, or surgical Band-Aid, you know.
That's why I'm so interested in what you do, because I I agree with the pattern. Like, I agree with the solution that you guys are trying to get to. It's not, oh, hey, I'm depressed. Oh, here's some Lexapro. See you later. It's, okay, well, why are you depressed? What's going on chemically? What can we do with your blood? What could we do with your diet? What could we do with your exercise that could address that, rather than just put, like you said, put a Band-Aid on it. My question...
Because you could even do like St. John's work for depression, but that's still not addressing the cause, right? It's still using something natural against that pathology, depression, but not looking at where it's stemming from. Maybe you sold your childhood house and that's making you depressed and that's traumatic, and then you're taking on pain from that, you know? So we want to try and understand what's going on with people within them, and trauma there's no competition, right? My trauma could be something physical, but yours could be emotional, and we still feel the same pain or ailment because of that. But we need to at least assess what that problem is, get that awareness, and then try to find tools and strategies to navigate that and work through it. And I think that's where, the population that you target here, giving them tools is equally as important, especially any of those shift workers. And I'm sure we'll get into that.
Yeah. So what turns a medicine into what you would call going against nature? Like, so opiate, for example, that comes from a poppy seed, right? Mm-hmm. How does it, like, throughout the pharmaceutical process, become something that is not natural?
Well, if we look at California poppy, that's another herbal pain reliever because it has an opioid-like mechanism of action. But I think in a lot of cases, the toxicity is in the dose, whether we're talking about dietary habits or we're talking about some supplemental habits. It's really, I think every pharmaceutical has its time and its place. That's the other big misconception people get when they come in to see me for the first time is, oh, I'm on semaglutide or Ozempic or Zepbound or tirzepatide or whatever. I know you won't be in favor of that. Well, how do you know? I'm a huge fan of those drugs when used properly. It's just the use of them and going to something like an opiate right out the gate is where there's a problem. Right. You're not looking at, all right, let's do some physical therapy. Let's try and eat a less inflammatory diet. Let's not get fast food for the next 2 weeks. Let's try to cut down on carbs. Try not to go too crazy with our blood sugar. And let's see how your body feels. Maybe gluten's doing it. Maybe dairy's doing it. Maybe sugar's doing it. Maybe all of them are. But maybe you need to be more restrictive in your dietary and lifestyle habits before we start giving you things. But it makes medicine easy. When you have a drug that you could just say, here, it's going to make you feel better and you don't need to come back. Traditional medicine in the hospital sense is often a treat them and street them mentality, where we're going to treat you, we're going to send you off to the street. All right, you're not my problem anymore. And that's okay. You want to use that approach to care for an arm falling off or something along those lines, but you don't want to use it for management of a chronic disease. And that's where our field shines. And now we see in the traditional world, we're getting other providers that are starting to look at this and they're saying, wait, this does have something to it. And that's why this whole functional medicine sector has come out, is because they're looking at how things are functioning instead of just looking at the more acute care problems, where it's helping to manage a chronic disease a lot better and more effectively. But it's more the mindset that makes drugs and using the drugs improperly, that's where that allopathic mindset, I think, fails. It's going to save your life if you have pneumonia, you need a hip replacement, you need surgery for your cancer to be removed, etc. But it's not going to help in the long term when you're dealing with a chronic ailment. And that's where we're working with people, and especially things that traditionally trained doctors don't do a lot. And that's why hormones is one of my specialty. Hormones is something that can help people to not only feel better, but it can also influence cardiometabolic risk. And I see a lot of people with hormonal issues as they age, causing cardiac issues like low estrogen or low testosterone, causing high cholesterol. And as we improve that hormonal balance, the cholesterol is normalizing itself. And so instead of putting that patient who's already feeling depressed or tired or having sleep issues or joint pain, instead of putting them on a statin, which could make some of that fatigue or pain a little worse, and it's only treating one area of your metabolic health, you want to look at something that would influence that and also give you a quality of life. And that's why I got into hormonal imbalances, and because of my own journey with my own hormones. So I'm hearing a lot about addiction when you talk. Mm-hmm. Just abusing maybe some of the pharmaceuticals that people could be given with like traditional medicine. And affecting those, chemicals and stuff that are like the neurological chemicals and stuff like that. So there's a school of thought that say like it's kind of like you're either like that addictive personality, right? Like we've all heard the phrase like, oh, he's got an addictive personality. Do you buy into that? I think we may all have some genetic predisposition for an addictive tendency, but I think our environment plays a bigger role than we tend to lead on. Our environment being the people that we're surrounded by or things of that nature. For example, my brother was an addict, and unfortunately, he's no longer with us. And I think being around that type, but he also had a lot of mental health issues. He had struggled with anxiety, and I think it was a way of suppressing those emotions. Because as men, we tend to suppress things because we got to be strong. We got to be strong for the family or any of those things. And I think in that scenario, I think there's some people who do have a genetic predisposition, but I think our environment is really what creates more of that behavioral risk. And, I mean, we're all addicted to social media, right? I mean, look at your screen time. To
that point, there is an algorithm that could get anyone kind of addicted.
Yeah,
right.
Of course.
They're definitely, whether it's credit cards or social media or drugs or alcohol, whatever it is, there's definitely an algorithm that everyone has that can kind of tap into that.
Yep.
That addiction
and
in your
sugar.
brain. Yeah.
Sugar is hugely addictive, right? Why do you think we have so much obesity and all of that? But that's another whole ball of wax because we got other toxins that'll influence obesity too.
So one of the one of the things that we've covered in this podcast has been addiction in construction. And we put up articles and I've done a little bit of independent research, like showing, like just to see that, and there is a correlation between construction and addiction. People that work construction have a higher maybe risk, or maybe they already went into the field of construction as a result of addiction. What's your thought on that? Like, do you think that the field of construction kind of taps into that algorithm that can cause the addiction, or do you think that people who are already they already have that embedded in them kind of gravitate towards construction?
I think there's a lot of factors that are going to influence that occupational hazard in the construction world, because you have toxins. So you've got mold, you've got non-metal toxins, which is the dust particles and everything that's not metal, pesticides, etc. You've got metal toxins like soldering and all of that. You also have shift work, which is known to predispose people to psychosocial problems with, sleep pattern disruption, especially when you have shift work that's not regular. One of the best things a shift worker can do is ask their boss for a regular schedule, even if it's through the night. If it can be you wake at the same time, you sleep at the same time, and you work at the same time, that would set you up for a lower risk potentially of having these mental health issues. But you have a lot of different hormonal things that get disrupted from sleep disruption. So I tell a lot of my patients, the way that I look at things is there's three major hormonal systems that work together. Your sex hormones like testosterone, estrogen, progesterone, etc. You get your cortisol, DHEA, which is your stress hormone system, and you get your thyroid system, and all of them work in cahoots. And then you can also add in hormones like insulin, which is for your blood sugar, and hormones like vitamin D and melatonin, which get disrupted with shift work, melatonin in particular. And anytime that orchestra gets stressed out, it's not going to play to the right tune, right? If you're listening to an orchestra, if one of the sections of that orchestra is out of tune, it's not going to sound good. Well, that's going to translate into you not feeling good. So I do think not only do these toxins have an impact on our risk of mental health issues, but also the ramifications after the exposures to those toxins are also going to leave you at risk. Now, I think there's probably some needing to go to work and needing to provide and needing to get pain relief so you can get through the job as well. But I think underlying that, and I see a lot of contractors and construction workers, there's typically some underlying nutrient or hormonal problems. And with the style of that work, you're not going to get the greatest diet, and you're not going to have as much time to exercise. And that's what we see in some of the research, is that the lifestyle of a blue collar worker predisposes you to less physical activity, and that predisposes you to a laundry list of medical ailments. forget about all the other toxins you're exposed to and anything else. That alone is going to predispose you to having issues, is not being able to eat as well as you want and not being able to exercise or do the physical activity that you need. Because you need physical activity outside of your workplace. I don't care if you're walking around as a, person and getting 20,000 steps a day, you still need that deliberate lean muscle contraction. You still need that walking out in the air, not thinking about something oriented with work or letting your mind go where it wants to go. You know what I mean?
Well, so yeah, I think a lot of construction workers kind of consider their job as their exercise, right? And you're saying that you have to consider what's going on in your mind while exercising, or it kind of like doesn't count as exercise.
Yeah, it doesn't seem to have as many clinical benefits as somebody who's doing the deliberate muscle contraction of an arm curl or a body weight squat versus picking up a piece of sheetrock or picking up a piece of plywood isn't the same thing. You're not doing that deliberate contraction of muscle and having intention there or having your mind go where it wants to go. You're thinking, where do I need to put this sheetrock? Where do I need to put this plywood? You know what I mean?
So in MyFitnessPal, you can't put like fairly active then? It's like, it doesn't count?
You'll get moderate activity benefits out of it, but it's not going to be the best type for your overall health.
Okay.
And, and then a lot of construction workers that I see, they're getting something on the go, whatever's fast and easy.
Yeah.
And you're not always choosing the best option. And I probably wouldn't want a salad on my way between jobs either. You know what I mean?
Yeah, it's tough. It's tough to sit and eat when you're working. A sandwich is always like just the bet. You can just grab it and go, and that's it.
Exactly.
They have stuff like 647 bread now, Ezekiel bread, stuff like that where you can really mitigate that a little bit.
But you need to prepare.
You do.
And if you're already depressed because of your sleep schedule or because you're not exercising enough on your own.
It becomes very overwhelming.
Yeah.
On a Sunday night, you have a whole week ahead of you. You just spent, $300 a ShopRite, and you're just like, you don't want to do anything. You don't even want to make your coffee in the morning.
Well, and that's why I was meal prepping before I came here, just to try and prepare for some of the meals during the week. Because I work Monday, Tuesday, Friday until 6. I get home, around 6:30, 7 o'clock. My son goes to bed at 7:30. My daughter goes to bed at 8. I only get an hour with my kids. I don't want to spend that time cooking. I'd rather have those meals ready so that when I get home, we're all ready to sit down and eat together, and we're good. We can get bedtime wrapped up, and at least if I do that, I know what my kids are going to eat. It's not going to be that quick mac and cheese or something. It's going to be food, real food. And I tell that to my kids all the time when they ask me for fruit snacks or gummy bears. I'm like, well, what's the rule? I got to eat real food first. All right, so eat some blueberries, eat some strawberries or a banana, then I'll give you some fruit snacks. We're not going to have more than one today, but at least you got to add real food into your lifestyle before you can get something that's highly processed. And I'm not restricting them from it. I think they should still have the life that you and I had where we would have, pixie sticks or whatever, but at least being mindful about how food is eaten. Food order can play a big role in everybody's overall metabolic health. And that's something that's so simple that we've reversed hundreds of people's pre-diabetes and diabetes with. And it's something that I try to implement in my kids at day one.
Yeah, I had last I checked, I had pre-diabetes. I got my numbers down there through Weight Watchers.
Nice.
But since October, I've been a piece of shit.
Well, everybody's got their tool. That's why those
tough,
tools are available, is because so many people are just on the go. And I've got some people with pre-diabetes who have 10% body fat. And it's like, whoa, why do I have pre-diabetes? And it's because of stress.
Yeah.
Stress has a huge impact on your cardiometabolic risk, because whenever you're secreting that adrenaline, you're secreting insulin, and you can start developing insulin resistance. And that's like what I describe as pre-diabetes. And you can test for that. And those are the types of tests that I'm referring to are not done enough traditionally to tell people where they're at. Last April, I've run insulin resistance testing on myself every year. Last April, I ran an insulin resistance test, and I had insulin resistance, which can predict diabetes 10 to 20 years in the future. And I said, oh crap, I need to change it up. So my Monday, Tuesday, Friday, I get like 3,000 steps in a day. So I started up in that. I started doing more running. I started running a 5K 3 days a week. And within 4 months, my insulin resistance was gone. But that made my awareness there so that I know what I got to do for my biochemistry to make sure that doesn't happen again. And that's what we try to teach our patients. We try to teach them what are your risks? What are your areas of weakness biochemically in your blood testing, so that then we can track and monitor them over time? Some people I see in their 20s and 30s, I see every 3 or 4 years. I'm only seeing you every so often, so you don't need a billable appointment, and so that you are educated that we're going to continue to monitor these risk factors for you over your lifetime. Once you're a patient, you're always my patient. And it doesn't mean you have to come every year, you know? So I think our medical field with chronic disease management and prevention has really had a lot of failures. And that's where I'm trying to just educate whoever is willing to invest in their health. And I'm hugely appreciative for all the support I've got from patients, because without the patients, I wouldn't have the job that I love. I feel like I just talk to people all day, you know, and I educate them, I teach them, and we make little tweaks here and there, but at the end of the day, it's all about giving people options and educating them on where their areas of weakness are, so that we can track and monitor them over time. Or they can use another provider to help them track and monitor. I don't have to be everybody's doctor. I'm not the only person that can get people well. You know, I'm booked out till October right now for new patients.
That's awesome, dude.
So I refer to a lot of other NDs in New Jersey, just so that I can support my profession and still have people get access. You know, I had a patient that called like 3 months ago, and I said, hey, you know, call this other center. You know, I know somebody who works there. They can at least give you an assessment and help you out if you don't want to get on my wait list or whatever. And they said, oh yeah, we tried calling them and they didn't call me back. So I texted the person I knew there. I said, call this person back. This is their name and number. Get them on the schedule. She got them on the schedule. They were going next week to that place. And I said, great, because I wouldn't have been able to see you for a good 4 to 6 months. At least you can have somebody help you start that process and start that education of what should be evaluated, where are your weaknesses, and then give you tools to start working on that.
I gotta make an appointment for,
For
October. Yeah,
for
I'll see you in
October,
October. Yeah. So, dude, I have so many questions. I want to get back to shift work. So you talked about how shift work can disrupt the orchestra that is your glands, right?
Your hormone systems, basically.
Your hormone systems. Can you almost, as a blue collar worker, consider basically any shift, right? Because even if you're working 7 to 3:30, like that's your shift. You're waking up early. Like a lot of times, we're not just going like, oh, I know I got 20-minute drive to work every day. Sometimes it's an hour. Sometimes it's an hour and a half. Sometimes you don't know what you're doing that day. So you're waking up, you know, between the hours of 5 and 6. You're getting ready. You're going to the job. You are exposing your body to the toxins that we talked about. The stresses. You're coming home, like you said, to your point, you know, the kids, you know, you got the kids, you got like whatever you're doing. By the time they go to bed, I mean, it's like whatever, 8, 9 o'clock. I have a newborn who won't go to bed till 11 now. And a lot of times, like I know me, for example, like I need the kids to be asleep for like an hour for me to like really wind down.
I hear that.
Yeah. So when she's going to bed at 11, I'm almost up till midnight every night just to wind down. And then I'm up at 5 o'clock in the morning the next day. So that could almost be considered like shift, you could almost get this. It's not as dramatic as working 7 p.m. to 6 a.m., but it's still affecting those hormonal glands. Yeah.
It still applies as a shift worker. That's why I mentioned before our conversation, you know, shift work isn't just people who have a scheduled shift like nurses or construction workers or any of that, janitorial people at a hospital or something. It's also people who are in college staying up late and studying, or people who are moms or dads that are staying up late for their newborn. So that totally applies. And sleep deprivation is, you know, cumulative. You know, it's not just, oh, you know, this happens and that's just what it is. The best person and the best resource that I've found up to this point to understand what lifestyle strategies can we utilize to help support shift workers is Andrew Huberman out of Stanford. He does great podcast, wrote a book, all of that, but he digs into the research on a lot of these things. And what he's found is that the first thing you want is overhead light exposure. As soon as you wake up, turn the lights on as bright as you possibly can. Start stimulating some of that cortisol. Because like I was saying, getting in that routine of I wake up at 5, I go to bed at midnight, even though that's not the ideal situation, doing it consistently seems to be very beneficial for people and reducing the risk of that hormonal disruption. So turning the lights on as bright as you can when you wake up. But then the opposite, especially overhead, lighting. But then the opposite, when it's later at night, if you have light exposure between overhead light exposure between 11 p.m. and 4 a.m., you are going to create a shift worker body in yourself. So you want to try and have just lamps on. You don't want to have a TV on a wall if you're a gamer, all the way above your eyes, really bright, and an overhead light over you. You want your TV at eye level or below, and then you want like a lamp light or a night light around you instead of overhead light, because that's going to stimulate the bottom of your retina to secrete cortisol or suppress cortisol, secrete cortisol production. And as we sleep, we want that to go down. And if that's on when we're about to go to sleep, we'll probably be in this tired but wired situation where we can't unwind for another hour until after the kids in bed.
That's very interesting. I wonder if, because like when you're a very little baby, like everything is overhead.
Yep.
So we got to turn some lights out. Might help with the 11 p.m. Go to sleep issue.
Yeah, just do a little lamp. Just have a side table.
Well, we have a lamp, but even
on.
the lamp is overhead. She's like the size of that coffee mug.
Yeah.
She's a little bit. Yeah.
Yeah. But I mean, he's the best resource for some of that work.
Yeah. And
he's got a book written out about how you can help to offset some of those negative things.
So that seems like a simple. Like that's a simple solution.
And then things like waiting for caffeine for about an hour after you wake up, not getting that hit of coffee as soon as you wake up, like letting your body secrete some of that cortisol, some of that adrenaline before you get an artificial spike in it, because then it's going to be more likely to create this peak and trough, not just in your, stress hormone response, but also potentially in your blood sugar response as well.
Interesting stuff. So I'm very, like, I always heard that stress causes all these issues. Do you have any type of like, I don't know, just an explanation that could be understood that like how and why does stress cause bad shit?
So the adrenals are where the stress comes from, or where the stress hormone cortisol.
Can we define stress first? Like, what is it to feel stressed? Is it that?
So stress is, for me, I describe stress as things that I can control to the patient. So things that are biochemical. So that's what I describe as stress, because the environment we have no control over, right? All we have is right now, you and I having a conversation. We have no control about what just happened before we got in here. We have no control about what's about to happen next. So stresses, in my mind, are things that I'm able to educate the patient that we can get control over, because really we have very little control over much in our lives. So if I can give somebody some empowerment and hope that we can gain some control in their health by looking objectively at where their weaknesses are, that's the stress that I'm referring to. I'm referring to stress of not enough zinc, B vitamins, omegas, magnesium, hormonal stress, autoimmune stress, inflammation. I run about 11 inflammatory markers on people, and some people have 3 and some people have 12 and some people have none. The 12th one is usually something different that we would run through a urine testing. But the stress that I describe is biochemical stress, because that's something I can control, instead of looking at stress from, what is stressing your relationship, or, your financial stresses, or any of that stuff. I don't have control over any of that. But if I can give people control over what's going on in their biochemistry, then that's a win. Because if you lose hope when you're trying to approach a patient case, you're never going to see any improvements, no matter how good that thing has research on or whatever. Once you lose hope in a patient encounter, you've lost everything, because nothing's going to work. So I look at stress as biochemical, as nutrient, as inflammatory stress, as hormonal stress. I don't typically look at it as, the things in the external environment of anxiety or depression. I think that's a presentation emotionally for something that's going on biochemically. So that's what I'm looking at, because I have control over it. I don't have any control over that screaming baby as soon as we get home and we get that kid handed to us. You know what I mean?
Yep.
So, but we all have stress. It's just how we manage it, how we navigate it. And a lot of times we're not doing enough to make deposits in our mental health bank account regularly so that we can manage the stress when things hit the fan. You know what I mean? So I tell people I deposit in my mental health bank account every day. And my main deposit is gratitude. So every morning I wake up, I take the dogs out. I thank God for today. I thank it for my family, for my patients, and I thank and for my friends, because without that, and my life, because I have a great life, and it could always be worse, right? So the gratitude is my mental health deposit that I make every day, every morning and night when I take the dogs out. It's just a routine that I've developed. Other things that you can do to help your body manage stress is, deliberate cold exposure, not like getting stuck in a snowstorm because your car broke down, but like deliberately going in a cold bath or sauna or meditation or prayer or something like that to try and give and exercise. Exercise, I think, is so underappreciated as a form of a deposit in your mental health bank account to help your body manage stress biochemically so that your mind is right.
I told Flounder about this, actually. One of the things I do to eliminate stress is I buy all the same pair of sock, so I don't have to
think about it.
Yeah.
Yeah. That's why I liked the uniform when I was in school.
Is that not a great idea?
It is.
Success. What else? What was the other one I said? There's socks and something else. Oh, black coffee. Number one, you're not putting sugar or cream in it.
Exactly.
Number two, you don't have to think about it.
Yep.
You just drink it and it's done.
Yep.
You don't have to stand in, you don't have to like bump shoulders with people at Wawa. You just pour it in your cup and you pay for it and you're done.
Yep.
Stress eliminated. Totally.
Well, that's why Friday I wear the same outfit to work on Fridays.
Oh.
Because by the end of the week, I don't want to have to think of another thing.
Yeah.
And it may seem crazy, but it's less to think about. And that's one way that I can control my stress, right? And one way you can control your stress is by having the same socks and not having to look for a missing pair or something. But yeah, those are strategies that anybody can implement to try and navigate the stressful world we live in,
Roger that. So we talked about some of these toxins that we're inhaling as, as construction workers, as laborers, whatever, electricians. I'm sure they, every field. Is there any benefit to exposing your body to the toxins? Like, does your body
get more resilient?
Yeah.
Maybe. I mean, I think there's something to say about deliberate stress exposure and our body becoming more robust or stronger as a result of it. Really, it's just the accumulation of it that's a problem. It's not that something is going to be toxic because of one exposure. It's the persistent exposure to something. And that's where a lot of these chemicals that are in our foods, even just in the wrapping of the paper at McDonald's, that's probably worse for you than what's actually in that burger, because those toxins in that wrapping is so inflammatory to our hormonal system. A lot of them have these PFAS chemicals, which are things that are in like flame retardants and water resistant device, things and stain resistant things. Those chemicals stay in our bodies for virtually forever, especially if we don't have very good liver detoxification. And so one of the things that I'll measure for people to see if one of their areas of liver detoxification is working effectively is a marker called homocysteine. It's a blood test to tell you how the body is activating the B vitamins that they're consuming in their diet or taking as a supplement. And that process is called methylation, which is one of the 5 or 6 major pathways of liver elimination. And if that's high, then you already have one area that you're not efficiently getting toxins out of your body. We're never going to not get exposed to toxins. It's just trying to make sure that we minimize as much of the exposure as we can, possibly. That's why masks are good for dust and headwear is good for ears and all of that. Eyewear is good for eyes. But we're not going to be able to avoid everything. But if we can see how efficient your body is biochemically, or if you're not sweating, or if you're not having a bowel movement every day, or this, B vitamin utilization marker, homocysteine, is high, then you're going to be predisposed to that accumulating in your body, creating stress on your body, which we call oxidative stress, which is basically like a wrench rusting, apple turning brown process happening to the batteries to our cells called our mitochondria. So anytime we get that oxidative stress, but we can't clear it out quickly enough, that is going to predispose us to every medical condition. So oxidative stress is the cause of everything, between cancer and Alzheimer's to hormonal issues to fatigue, etc. But it's hard to identify everything because we don't have testing for everything. So we have some non-traditional tests that'll look at things like non-metal toxins, things like Agent Orange. We have a couple of old vets that we have tested, and they have some Agent Orange, based some residue of it or a metabolite of it left in their urine. So we'll do that, and we'll see, okay, this could be contributing to why you have pain or nerve issues or fatigue issues. Other times we may run metal toxin testing, which we run very commonly. We look at things like aluminum and arsenic and mercury and cadmium, etc., even tin and gadolinium, thallium. And a lot of times we'll see those toxins will create a lot of mental health issues and pain issues. So for people that we've run the whole gamut of traditional testing with LabCorp Request, and we're not seeing, or any other lab, whatever it is, and we're not finding enough answers for why somebody is still clinically symptomatic, then we'll still go digging for what I consider the non-traditional tests. So usually I'll start with metals because it's the least expensive. It's about $100. And if those are high, then we'll use a 10-week protocol to get them out. And we'll see if subjectively, if patients change in their mental health state. So I had a guy who had PTSD at my former office, and he was in the military, came home, he worked on the range a lot, had a ton of lead in him, like 10 times the amount of lead in him. So we started doing something called chelation therapy, which you should only do under a trained practitioner. And
what is it?
So it's the process of taking out metals.
How do you
That's
do
what
it?
chelation is. It can be done either orally, rectally, intravenously are typically the routes of going. He did it intravenously. And after this guy couldn't even make eye contact with you to have a conversation. He would just constantly look down. And after about 10 or 12 treatments, he was able to look in your eyes for a couple of seconds and then look down, and then he was able to go into crowds eventually. So we know that these metal toxins can definitely have an impact on mental health issues. And that's one of them that will be one of the first that we look at. Because even if it doesn't help your mental health, there is some data that suggests that getting those metals down will reduce your cardiac risk in terms of reducing your risk of a heart attack. So, and then the other one that I see much more prevalently than anything is mold or mycotoxins. Mycotoxins are mold toxins that are secreted in the air that don't have an aroma, but can make people very chronically ill, and especially can put people at predisposed risk for cancers or nerve issues or kidney function issues, etc. So there's a lot of toxicities that we can assess. We can even assess glyphosate. It's about $100 to test for glyphosate in your urine through one of the companies. And that's Roundup. And we can see if that toxin is at all accumulating in you, creating some neurological damage or hormone disruption.
So one of the hot topics that's been circulating on social media and, just that's been people are more publicly aware of is the use of psychedelics to address some of those PTSD things, some of the same things you're talking about. Is there any correlation to the metals in your body, the psychedelic? Like, is there anything you can kind of correlate, or is that just two totally separate means of addressing the same thing?
So it's addressing it in a little bit of a different way by changing the mindset, right? Because even if you have an exposure or if you have an injury, it doesn't mean you're going to develop the condition. So for example, if we all have imaging on our shoulders, but none of us has shoulder pain, probably the majority of us are going to be recommended surgery. So just because we have an anatomical problem, it doesn't mean that we're going to experience that clinical symptom pattern. So metals don't always predispose people to mental health issues. And other people, it may present as fatigue, or it may present as a neurological issue that's physical or musculoskeletal, or it's going to create intestinal problems like constipation. But psychedelics are a totally different area of medicine that's gaining a lot of research. And in the future, I would like to delve into a lot more of that and potentially lead people in trips or psychedelic, facilitator at some point in states like Oregon, where we are licensed to be physicians, there's a physician practitioner training that you can get to become a facilitator. And most of these trainings are not in the United States, but at least you can learn, if you do become a facilitator, what that would look like as the person who leads those retreats. But I do think it would be it's a great area that's coming up.
So that is in your wheelhouse as a naturopathic medical doctor.
Yeah, it's the use of mushrooms. It's using nature to address a pathology psychologically.
What does it do exactly? Like how's it work? Like,
so it seems to change people's psychosis. So they've done this on murderers. They've done it on people with PTSD from war, and they've found that it changes your mindset, and it really flips the script in a lot of ways. Now, I haven't done as much continuing education as I'd like to on it. I'm actually hoping to go do some continuing education on that and a couple of other topics in Manhattan in about a month. But it's still something I'm trying to understand, and we don't understand the complete mechanism of action. We don't know how entirely it works, but a lot of it seems to work on certain neurological pathways to try and change your perspective in your mind and your mindset. But like I said, I haven't had as much continuing education in this field as I've wanted, because I've wanted to come back to New Jersey as a naturopathic doctor and physician to educate people on their health options before I start getting into areas that are considered quackery, right? I'm already considered a quack because I don't have an MD or a DO from a lot of practitioner standpoints. But if I can build a reputation for NDs in this state, or even just for myself, before I start getting into those more woo-woo or, potentially woo-woo areas, whether it be cannabis or marijuana-based medicines or it be psychedelics, I wanted to give myself a good 10 years of my career before I started getting into some of that, because we're already seen as alternative. I want to try and at least gain some traditional acceptance before we get into, some of the psychedelics.
So is it safe to say that the psychedelics maybe just help to facilitate maybe a mindset that is required to dedicate yourself to making the changes that we're talking about right now? Like, yeah. Is that basically,
and probably to refocus back into the current moment, because that's all we have control over.
Because it does, right? It does take it takes a certain kind of mindset. It's a decision. It's a motivation, a determination to continue to do these things. Like I said, like I did the Weight Watchers, and just to hold that mind state for forever, like just to change. It's like a change in your life.
Yep.
It's not an easy thing to do. It's not an easy thing to consistently do. It's not extremely sustainable for everyone. And
for some people, it shows some paths they didn't know, right? Mm-hmm. So like sometimes we're just on this path and we think this is the only way it can go. And that's it. This is what our life is. This is how it's going to be. But we don't see that we can blaze other paths, and that's something, I've been fortunate to see that with my last job, to go and to open my own office is, I had an idea that I was like, okay, well, maybe I'll start blazing my own path instead of being stuck as an employee. And that's what I did. And I've been blessed to be able to have success in that venture. You know what I mean? So I think it gives people the skills to try and blaze that other path that they didn't see the first time.
Have you considered organizing with the other NDs in New Jersey to?
Yeah, that's actually one of the main reasons why I decided to come on to this podcast, is because I'm the president of the nonprofit organization for naturopathic doctors in this state. It's called the New Jersey Association for Naturopathic Physicians, or NJANP, and is in Nancy. And our job is to try and create education around our approach to care. Most of us, our foundation of knowledge is on gut health, because we were taught that everything starts in the gut. And we're seeing a lot more that's valid with, whether it's the toxin exposures that we get that are endocrine disrupting chemicals that disrupt our gut microbiome that lead us to having obesity, right? So there is a lot that does stem from gut health issues, but there's a lack of awareness that our field is here. So the New Jersey Association for Naturopathic Physicians introduced a bill in February of last year to license us as physicians, because there's two different basically types of naturopath or naturopathic doctor in the state of New Jersey, and in any state that's what we call pre-licensed, because we're not licensed as physicians in the state of New Jersey at this time. We're licensed in 23 other states, including DC, Virgin Islands, and Puerto Rico. But we've been working towards trying to gain awareness of naturopathic medicine in the state of New Jersey so that people can have access to some of these things that I'm discussing, have access to providers who have this foundation of knowledge to educate you so you can make an informed decision. I tell all the patients the first time I see them, I don't care what you do. I'm here to give you your options, whether it's a pharmaceutical for your depression or it's a supplement for balancing out the nutrients that are contributing to your depression. A lot of times we'll use both and we'll say, okay, well, our goal is you're on this antidepressant for 12 months. And in 12 months, we're going to discuss getting off of this. But every tool has its time and its place, and that's where our training has provided a great opportunity for chronic disease management, because it's not just a script or a surgery as an option. It's providing you other information, diet, lifestyle, supplements, whatever that looks like. And that doesn't matter. But we do have a nonprofit right now. The biggest difficulty with trying to advance the bill, which is currently stuck in the Senate Commerce Committee, is that we have a lack of awareness. And we don't have enough money to hire a lobbyist to be able to get us the meetings. I call every month to try and get a meeting with the Senate Commerce Committee chair, and I leave a message or, with the front desk person or with the scheduler, and I get nothing because I'm not a voter in their district. So it doesn't matter. And there's thousands of bills. So I understand their side of it, but it still can be frustrating for me, because ultimately I will never take insurance just because they don't pay doctors what they deserve to get. But I want patients to have the opportunity to submit my visits to their insurance for reimbursement. That's why I'm doing the lobbying, is so that people can get access and they can use the money that they work hard on to try and how much money they spend on insurance to be able to apply my visits to their insurance for out of my network deductible.
Yeah, and not just that, but it would probably open up a lot more ND offices, I would imagine, if he was a recognized physician.
It would. We have data.
You wouldn't have to send people 50 miles.
Yeah, we have data from some of our states that have become licensed. I think yesterday something popped up on my memories that about 12 years ago, Massachusetts would gain licensure, and we see a huge influx in naturopathic doctors who are license eligible into those states, and that allows more opportunity for people to have options, right? So starting this November, actually, I'll be starting interviewing in March or April, but I'm starting New Jersey's first residency for naturopathic physicians. So I'm going to be getting a new grad, and I'll be mentoring them and teaching them some of this stuff, because that's an opportunity for not only our business to grow, but also to advance our profession and advance access to this type of approach to care, and it's a big undertaking. I've got to write a 50-week curriculum, because I got to lay out how they're going to be trained. But ultimately, I think it's going to be in the best interest of everybody, between the business, the state, and even the person who's going to be coming in, because, I've gained a lot of experience in the last 10 years being in clinical practice. And I think it's something that I'm able to share. I feel like I have the time, or at least the motivation to share that with people.
Do you think it would benefit you to try and organize a union for all of the naturopathic doctors that are in the area in New Jersey?
Yeah, I don't know that enough of them are committed to do extra work. A lot of them are just working in their jobs, and that's all they have the bandwidth for, and that's okay. But a lot of them just want to, we've been getting together over the last 2 years or last year and a half, once or twice a year in person with whoever has the opportunity to show up. But yeah, we just have a lot of limits with how busy a lot of our practices are, and with our own families, that they don't really have as much bandwidth to put into it. And when they have put some bandwidth into it, they didn't really see any movement in legislation to be able to make any advances. So the energy kind of fizzled. But that's the other reason why I want to bring new grads in, is because I want somebody who's going to have a little bit more time and motivation to try and help out. You know what I mean?
Yeah.
So
Grassroots, baby.
Yeah. So it's all grassroots lobbying that I've been doing. I got the bill introduced. This is the second time I was able to introduce the bill, but it's tough. You know, I have my own business that I run, and I run payroll and taxes and all of that for. Plus, I try to do what I can on this grassroots lobbying. I mean, the lobbying is a job in and of its own. You know, a lobbyist costs about 10 to 40 grand a year to try and support, and our nonprofit only has 3-4 grand in it, you know? So it's just, there's a lot of people who have been in this state for a while and are comfortable, have successful practices, and don't really need extra added on to their routine.
Well, it's a shame that they're not looking at it for the future of the profession the way that you are, because I think that I mean, I give you a lot of credit for everything you're doing for the future of your profession. And I think if you had the support of your just co-peers, that you guys could really like come together and make some noise. And then, like you said, you know, if everyone starts kind of adopting maybe your 50-week curriculum, and we start getting more residents in, you know, you just grow and you get stronger. And I mean, that's the dream, right?
Yeah, ideally. But I can see from some perspectives why they don't want any advances, because you have to realize that when we become physicians in the state of New Jersey, we're also held to a standard as a physician. So let's say in Oregon and in my training, where we do hold a license as a physician, whenever we would see somebody, for example, with a sinus infection, we'd have to send them home with the prescription for the antibiotic, but we'd also send them home with the herbs. Because if we don't send that prescription and that infection spreads even further and creates more of a problem, then we'll lose our license forever as physicians. So that a lot of them don't want that liability that's associated with being a physician and not doing standard of care.
That makes sense.
If you have a sinus infection, you get Augmentin, but I don't want to give you Augmentin. I want to give you a sinus rinse and an herbal formula. But if I go that route and I don't give you the Augmentin prescription and you get worse, then I'm liable to lose my license for the rest of my life. So that's the biggest downside to us trying to become license eligible in states where we don't have a license, is that you're held to a different accountability when you have that physician title associated with it. But the biggest positive would be if you go to a naturopathic physician, you're going to one that has had extensive training on pharmaceuticals. I had somebody go to a health coach, not that health coaches are bad or anything, but this person was just out of their lane. This health coach told these people that they would get their cholesterol better. And, the woman, they were both in their 60s. The woman was on thyroid medication and the man wasn't on any medications, but they both had very high cholesterol. And he said, both of you just go vegan, everything will get better, and you come off your medicine, you won't need your thyroid medication anymore. Well, that practitioner doesn't know anything about that hormone or that medication. So when they came back after eating vegan for 3 months, the guy's cholesterol went down 200 points, from the 3s down to the normal range into the 120s, 200 or less is normal. Well, guess what? The wife's went into the 300s. It went up 150 points. Even though she wasn't eating any fat, she was eating vegan. And that's because and then her thyroid hormone was very underactive because she stopped taking her medicine. Well, we know the thyroid is responsible for your cholesterol management. So you're not going to have, even if you don't eat fat, you're not going to be able to get your cholesterol managed if you have a known thyroid condition and you need that hormone. So that's where this person was out of their lane. They were very hypothyroid. They were exhausted. They felt like crap. And that's where you need somebody to regulate natural practitioners, especially if they have an ND like they do after my name. Like I said before, some NDs in this state, more of them than not, have only paid a few $1,000s for their degree and have had no training on pharmaceuticals. Versus me, I've put 4 years into it, into medical school, and over 300 grand in debt to be able to learn this knowledge. And then I did a 2-year residency in Atlanta, Georgia. So my training is very different as a naturopathic doctor who's license eligible than a naturopathic doctor in the state of New Jersey who is not, who got their degree online or only took a couple of courses. You know what I mean? So that's why this legislation is so important, is so that the consumer knows what they're getting when they invest their time and money into a practitioner that says naturopathic doctor.
So that legislation would basically require all NDs to go the same route you did.
Exactly. Yeah.
And it would, which is in turn better for the patient,
Yes.
of course.
Yes. It would create differentiation
But that's also
in the
why
market.
you're getting met with resistance from your peers, because not all of them are.
Not all of them want to prescribe.
They're not all
and that's
gangsters like you.
Yeah.
Oh, yeah. I hear that. So one of our segments is dumb thing of the week.
Mm-hmm.
So I ask everyone. I'll ask you. What's the dumbest thing you've seen this week, or month, or year, or whatever?
So I renovated my office, and some contractor that I picked up,
Non-union, I'm sure.
no, non-union, decided to go and put some trim up that was not the same size all over the place, and said he was just gonna, cover it up and it would look good in the end. I'm like, no, dude, no way.
Is it abstract?
Felt like Fuck It Friday, If you've seen those segments, it felt like that. So that was just and then he was baffled by why I was firing him as my contractor. And I said, dude, I want straight runs of trim. Like, it's not that hard. What happened here? You have a smaller piece of trim at the bottom here. He's like, oh, I ran out of trim. I'm like, well, then you get new trim. And he's like, well, give me more money. No, I'm not giving you any more money. And then we found miles. It felt like miles of Romex in the ceiling going to 20 amp circuits. And I had to put 10 G's into my new place because of the electrical. And it's nothing aesthetic, just hazard.
Yeah.
You know what I mean?
Yeah.
So we got all that pulled out. So that was between the contractor who wanted to put the wrong trim together and try and doll it up, and the previous owners having just hazards. I couldn't believe that. But yeah, the trim thing really just set me off. My grandfather was a contractor for 50. My grandfather was a mason for 50 years. I went to jobs with him. That's not my field.
How'd you get hooked up with the hack?
It was somebody I had known, and I was like, I want to support a smaller business. I had a couple of estimates, and he came in low, but you get what you pay for,
Sure do.
So
you sure
I just said, all right, well, I'll cut my losses. I'll pay him for the work that he did, even though it wasn't the work I wanted done, and it wasn't done properly in my mind. He still did work. I paid him for the work that he did, and I sent him on his way, and I gave him a termination letter. And I'm like, this isn't how I want you to be doing my trim, man. And then
hopefully he'll learn a lesson.
Then later, I saw some vinyl plank floor behind a piece of the trim to level it out, and I was like, "Come on, dude! Come on, this is bad."
So some trim does need some shims, but I don't know, vinyl plank flooring for it.
Right, exactly. Get some shims.
Roger,
so that's what I saw. Trim.
Dude, thank you so much for coming down, for talking. It was a long time coming. I've been, asking you every time I see you out. You always tell me no. So thank you for saying yeah.
Of course.
I definitely want to get into your office, dude. I definitely want to get the old once over for sure.
Yeah.
It's gonna
maybe you can see my resident, because you'll probably be able to get in with them quicker. So then we'll get you set up.
Rock on with the resident. Hell yeah. That sounds awesome. Thank you again. Do you want to just give the name of your practice for anyone watching?
So I work at Jersey Shore Wellness and IV Center in Linwood, New Jersey. We just moved our office to C2 in the Linwood Commons District, and we see patients Mondays, Tuesdays, and Fridays from 9 to 5. So phone number 609-732-0708. So feel free to reach out to us. You can also follow me on Instagram, Kyle Meyer ND, N as in naturopathic, D as in doctor. And you can get a sense of some of the approaches that I make with certain patient cases and things of that nature. So, and then usually my kids are in those videos too, because I get more hits with that. So, and then njanp.org, N as in Nancy, N as in Nancy, P is our nonprofit that we're trying to get legislation. You can donate there. You can see our legislative updates. You can also see what our bill looks like and things of that nature. So any support for that would be great. But just really all about education and awareness. And I'm glad I came in to chat.
Yeah, hell yeah, I am too. And to your point, your LinkedIn, your Instagram videos, man, all those little nuggets, the cold wet socks nuggets, bring your toddler outside in the cold weather. Mm-hmm. I saw that one. It's good for their immune system stuff.
Yeah.
A lot of good nuggets. Follow them on all the social platforms. Thank you again so much for your time. It was great hanging with you, man.
You too.
Yeah.
Good to see
all
you.
right, man. Later.
Take it easy.